Welcome back. This is Canadian Fertility Awareness Week, a chance to amplify the conversation and redefine infertility. It's an issue that's likely touched someone you know. 1 in 6 people worldwide experience infertility. And Dr. Ariadne Daniel from the Alberta Reproductive Centre joins us today. Thank you so much for coming in here today.
Thank you so much for having me.
Well, it's nice to have you. So fertility, of course, can be a really tough topic to talk about. There is stigma when people struggle to get pregnant. Why is it so important to talk about that? And, you know, as you mentioned, redefine infertility.
Yeah, this is a really exciting week across Canada. It's a Canadian-wide, so it's Canadian Fertility Awareness Week. And this year, Fertility Matters decided to redefine or change the definition. We used to call it infertility.
Right.
We're looking at the understanding that there are many different ways that people make their families or build their families. Not all of those people have infertility. We're talking about single mothers or single parents by choice.
Okay.
We're discussing the LGBTQ2+ community, patients with pregnancy loss, those that have cancer diagnoses that are looking to preserve their fertility, and patients that are freezing eggs to empower themselves to be able to have the family on their own timeline.
Okay, that's so interesting. And so why is it so important that we, you know, make sure that we are letting people know that this is a problem that a lot of people experience?
Absolutely. I think we have the understanding that 1 in 6 Canadians are dealing with fertility challenges, but the World Health Organization just brought out a report saying that 1 in 6 worldwide are dealing with this issue. And if we think, if each one of us think of our small network of people, 1 in 6 is very significant. That's almost 20%. So I think it's really important. People are in silence often. They feel isolated. They feel like a failure themselves. There's lots of feelings that bring about issues that patients aren't always comfortable about talking to. So I think the CFAW week allows patients to really have that forum, that space to discuss those issues and to feel open to be able to do that. Nice.
Of course, people can spend years on wait lists for treatment, and there is a shortage of treatment centres, but I understand you will soon be opening the Alberta Reproductive Centre. Congratulations. And that's one of 2 clinics in Northern Alberta, is that right?
Correct. Yeah, we're really excited. We opened for new referrals on April 3rd, and we really believe strongly in 3 things. We believe that at minimum, people deserve the best medical care possible, meaning state-of-the-art equipment, premier professionals who have medical knowledge and expertise in their field. We believe, secondly, that people really need to be seen as a whole person. Fertility is a medical issue, but there's also the mental health, there's the physical and nutritional. We know that there's so many factors that are important in success rates. And we also believe that people need to have a patient-centered, compassionate place to access fertility care. And we have the most wonderful staff who walk alongside our patients on their journey, empowering them and giving them the support they need to make those important decisions about building their families.
Oh, that's great. And, you know, as you just mentioned, that fertility struggles are not just a medical issue, and your clinic takes a more holistic approach, is that correct?
Absolutely. So we understand that patients have relationships with holistic care providers in the community, and we really encourage people to continue those relationships and support them and build them through their journey. If they don't, we also have available at our clinic a registered dietitian, registered psychologist. We're working with Whole Family Health to bring acupuncture to patients on the day of embryo transfer. We also have numerous education documents that are evidence-based so that patients can really find the information that they need that's based on science. So we're doing a lot to try and look at how we can help people as a whole person, to see them as a whole person connected to so many different parts of communities, relationships.
So interesting. And I understand there are a couple of community events coming up. Tell us about those.
Yeah, so Canadian Fertility Awareness Week runs from today till the 29th of April. On Wednesday, monuments across Canada are being lit green, the High Level Bridge being one of them.
Oh, nice.
So we're encouraging people to join us there at 7:30, wear green. We have some treats available just to have that open conversation about fertility awareness. And we also have an event on April 30th where we're talking about sort of that redefinition of what does infertility or fertility mean, and then seeing people as a whole person. And we're working with Whole Family Health to bring those 2 initiatives forward to Edmonton. So we'd love to see people join us on those 2 days.
Sounds great. Congrats again on the new clinic. Yeah, I'm sure a lot of people will be very excited about that.
Thank you so much.
Thank you. And as mentioned, there are a couple of fertility awareness events this week. On Wednesday, 7:30 p.m., there is the Light the Night meetup at Kinsman Park. And on Sunday, there's a free hybrid event called Redefining Infertility with Whole Person Integrated Fertility Care that will be held online and in person at the Park Allen Community Hall. For event details, head to wholefamilyhealth.ca.